Now in your health headlines, it is a common condition that affects 38 million people in the U.S. We're talking about migraines, a potentially debilitating headache disorder. Dr. Mitchell Goldman from UCSD is here, as he is all the time, every Tuesday, with how sufferers can get some help or do anything about it. Dr. G, thanks for being here.
Always good to be here, Kathleen.
All right, so most of us equate migraines as being a severe headache. Is that accurate, or is there a different biology to it?
No, it's actually different than a regular headache. You know, many things can cause a headache, like stress and looking at your computer or cell phones for too long. But a migraine is something very different. It's actually a neurological problem in the brain, and it affects about 18% of women and 6% of men. And what happens is you either get a constriction of blood flow, or more commonly, there's a chemical reaction in the brain that actually causes pain, and many different symptoms can occur from migraines.
And how do you know it's a migraine? Are the symptoms different?
The symptoms are different. Most of the time, it's just on one side of the head, and then we have a number of symptoms, the most critical of which are nausea, vomiting, light sensitivity. So that's different than you would get from a regular headache. Now, migraine headaches can last for anywhere from 4 hours to 3 days, and they can be very debilitating. They can occur oftentimes more than 6 to 10 times a month. And so since migraines have such a big problem on our work environment, there's a number of different treatments that we can actually use for migraines to help prevent them or make them much less painful for us.
Well, before we talk about those treatments, I'm intrigued when you talked about triggers. There are some common ones, although everybody sort of experiences different things. Can you talk about what some of the triggers are?
You know, there's so many different triggers out there. These are the most common ones. Hormonal changes. So during a pregnancy, during menopause, if you're taking birth control pills, lots of different kinds of foods, skipping meals, food additives, especially something called asparagine, which is a sugar substitute, and then drinks, especially red wine and some types of high caffeinated beverages can cause it. Of course, things like stress, but lots of sensory stimuli like different kinds of smells or bright lights. So there's a whole host of things that can actually make migraines come on.
And you'd almost have to keep a journal or something to figure out how yours are triggered maybe personally. So what are the treatment options out there other than turning off all the lights and laying down, which is what we see a lot of people do, which is why you're talking about lost productivity?
Yes, you know, a lot of the over-the-counter medicines like aspirin and Tylenol and Motrin are helpful, but really what we found is only 4% of people that suffer from migraines actually go to a physician. But fortunately, there are a number of different medications that a physician can prescribe for you, being anywhere from pills that control high blood pressure, which interestingly have nothing to do with the high blood pressure, but can control migraines, to different types of antidepressants, to now there's new medications that are coming out called calcitonin peptide growth inhibitors. And what these peptides do is they actually will block some of the nerve centers in the brain which cause the migraine. And so even though the treatments right now are hit or miss, there's some new treatments in the future. But perhaps the most common treatment that we do now for chronic migraines is simple Botox injections. You know, just getting Botox injections into the areas that cause frowning like I'm doing now, in a third of the patients will prevent totally migraines from occurring for 3 to 4 months. In another third of the patients, they actually decrease significantly the effects of migraines. And then a third of the patients really require additional treatments.
All right, but it certainly sounds like if you do have recurring migraines, it's important to go back to your physician and see what's new and what's available now.
It really is, Kathleen.
All right, Dr. G, always good to visit with you every Tuesday.
Nice to see you.